Did I start?
I believe so. I got a notification.
All right, so we should be good. I'm just gonna wait for Beste and then to just send me a confirmation. So I think Beste was criticizing me the other day because of the way that we are actually um, sharing the screen. The reason we are doing that is because we wanted to make sure that our picture is up, the video of ours, mine at least, so you know who's talking. And I want to take the entire uh, screen, and then we have our PowerPoint. I'll make some references to the PowerPoint, so that's why I wanted to have this. Now, as most of you know, we don't have any commercial goal from this. It is more about reaching out to our patients and more about our main focus probably is Delaware, but from the clinical integration standpoint, because we are a United Medical ACO, accountable care organization. So, but we are also probably addressing the issues nationwide from the healthcare standpoint, not only with COVID-19, but other chronic care management issues and what's expected from our patients these days. And we're just going to walk you through once a week. We wanted to do today's call through YouTube video, but we still have some challenges with the um, with the technology. So we should be getting better now. So Besta was saying, move your camera from the screen. The reason I was doing that, so then either I'm going to share the entire screen and I didn't want to just PowerPoint. Okay, she says, never mind. So, okay, I'm still talking to our people while we are going through this. So now, what I would like us to do is look at the numbers. Every every week we have three presentations for our providers, for our physicians and nurse practitioners and physician assistants. The reason we do that is we want to keep everyone in the loop in terms of the communication, what's coming, what's not. And one of the things that we have, I make reference to this slide, the comparison of the total number of confirmed cases with the numbers from April 15th. We had about 1 million total cases versus May 15th, that number was close to 1.5 million. Right now, we are 3 times more than May 15th in 2 months period. So just kind of see this side by side probably would help. This data comes from worldometer.info. They also share the recovered percentage here. So these are the total patients who are confirmed to recover. So that percentage, as you can see, from 71% to 78%, and now it's at 94%. That number is good, as that's getting closer to 100%. It's going to be better, but that is also happening from the good side. Now, what's coming? What may be on our way is uh, this picture, the wave of what's going to happen, what's already happening, and then this is the time when we were all freaking out, and now we are here. As you can see, the issue is at a bigger level, but our reaction, I guess, kind of changed, and the way that we are handling is changed. So, but this issue is real. Now, one of our biggest concern is with the school opening. This is going to get, but schools may not be all fully open, but I guess they are talking about like 2 days in school and then 3 days online. That's just have a lot of challenges on its own. And then the fall season with the flu, it's going to make certain population more vulnerable. So we are going to be watching this very closely. Now, one of the updates that we had from our last night's conversation was the statement from Dr. Fauci with some of the states with their new positivity rates going up. And then this is something that may be happening with those states. And then Indiana, Ohio, Kentucky, Tennessee, and Virginia are those states. So that's where we are right now. So we do have a specific Delaware update because we are from Delaware, and new positive cases is here. This is as of yesterday. So the numbers, the orange one is something that you may not want to pay too much attention for day to day because that's all about the reporting of it. So if the state doesn't work on the incoming results right away, the number may be low one day versus next day they catch up and then that number is going to be higher. However, the blue bar is the averages of 10 days, and that's an important number. And that number is increasing in the last several days. Now, this picture here is the percentage of persons who tested positive. And again, this number is, I believe, the blue bar is the 10-day average again, and that's about 4.2%. So that's a good number. And Delaware is managing this much better than any other states. Now, I do want to give you an update from our own ACO. We are day to day, we are actually checking our business development. Some of our care coordinators and our practices, we are checking each order and we follow up with our patients. Now, this call is more focusing on our patients and public. Therefore, I want to make sure that this is understood. Again, this doesn't have any commercial purpose from our side. I personally want to share this with you, and then I have a great team to help me to make this possible so that we can make time for these. So what you see here is our internal orders for corona test, and in June, when things were kind of settling and kind of going down, orders were low, and then we started communicating with our providers to make sure that the number of people that we are testing shouldn't be less than 300 a week. And then since we did those presentations, then we saw immediate response from our providers and our patients. So we are ordering anywhere from 300 to 360 total cases every week. And then we follow up with these cases to make sure that patients are able to follow up. Now, why this is important, and you may have read the news regarding the 12 cases incorrectly informed by I believe it was Walgreens. This was the news, so I'm not naming anyone, but it was the Walgreens pharmacy with 12 cases, and patients were positive, but they were told that they were negative. And if the primary care physician is not part of that care, and if we are not able to follow up on these orders, then these types of mistakes will happen. So I always tell our patients and tell our providers that primary care physician is the center of the care that's being provided. Therefore, it would be best if everything goes through initiated by primary care providers, and that's what our network is doing from United Medical side. Now, I just see a blue square on my face. I don't know if everyone also sees that, but that's not my new glasses or anything. It's just like the way that technology that's kind of challenging us.
You may be able to switch applications, camera applications.
Okay.
Try the Logitech one.
Logitech?
I think that's what we used last time.
Yeah, I can do that. So I'm going to change my camera, and then I think I'm going to get criticism from Besta. Let's see what she says. Okay, so she is all right, so let's see if I'm going to close this, and this didn't come up, sir. Pictures. on the Logitech. We are having a little bit technical issue, and it will be right back. Hold on 1 second. So it is, when I open that, we were doing
Quick capture.
that's what I did, and okay.
Yep.
So it needed Tanner to just look at it, and then he didn't even touch it. It's fixed now. So okay, so I think our point on the corona orders is there, and then we're hoping that you would be following the primary care provider's orders, and you complying from the patient point, you stay compliant with the program. Now, from the United Medical side, it's a very complex, clinically integrated network with several accountable care organization contracts that we have, and then we manage our patient population with hospital admissions, discharges, follow-ups, medical weight loss programs, fall prevention, diabetes, and we also have a nutrition from the diabetes side. We are accredited from the American Diabetes Association, so that's kind of what United Medical does as a reminder. Now, part of that, another thing that we do is our number of hospitalization as part of that program, and these number represents each discharges that we have from the hospital. We don't go to the hospital, our providers don't go to the hospital unless they are specialty, but this is from the family physicians and from the internal medicine. Our patients are taken care of by the hospitalists. Now, as you can see, the number did decrease in April and May due to the corona, and now we want to make sure that this number is not disappearing because there are necessary hospitalizations or certain issues should be handled in the hospital setting, and then we are seeing that number going up. Of course, the unnecessary hospital utilization is not what we are focusing on. We are happy that those numbers are low. However, there are necessary admissions that needs to happen, and we don't want to delay the care, especially with patients who are chronically ill. And then we do the same thing from our integration side with the with our orders. If your primary care orders a cardiology consult, it will be in these numbers. If they order a bariatric consult, it would be part of these, or nephrology or pulmonary. And what our care coordination team with the leadership of Donna Gunkel as our director, we are managing those orders day to day, and then make sure that patients are getting their appointments and all that. Now, one item that I would like to share, I'm going to actually have my screen changed. All right, so where did the other one go? Let's see. There is something on YouTube. Now, during this time, telemedicine became the main focus for us. And with telemedicine, what's really important for us, what we would like our patients to adopt very quickly is IQ Health, which is our patient portal. And I do want to play this video, and I'm hoping that the sound is going to be okay.
Are you ready to take control of your health and your time? With the IQ Health Patient Portal, you can access all your important health information anytime and anywhere, from your smartphone, tablet, or desktop computer. Send and receive messages to and from your providers. View your test results. Request medication refills. Request an appointment. And update your demographic information. Download the Healthy Life app to your smartphone or tablet for convenient access to your IQ Health Patient Portal on the go today. Are you?
So that's our IQ Health for United Medical. All of our providers are using the same system, and they are clinically integrated. Therefore, you do not need to use different portals if you utilize our providers. So that's why this is really important. If you are utilizing the patient portal, and if you are not able to reach out to us, you are able to send a quick message through the patient portal, and then we will be calling you or we will be messaging you. And then there are so many different ways that you can actually you can get records, what you need. You may, other specialties that you are working with, they may need these records. What I see is, and I'm sharing some of my opinions in these settings. It's not the technology the problem. It's in some cases it's us people. We are the problem because we are kind of insisting on not using the technology, and as we are not using the technology, it just becomes more problematic for us to keep up with the technology itself. Because if the IQ Health requires us to use the system, so then you can use the highest technology available, then that's the only way that you can actually what I'm trying to say is that you can actually take advantage of the technology. So that's kind of what it is. This is on our website. From patients of our network, you can always use our United Medical website and then get some of the information. Now, the other thing is we do have other webinars on a regular basis that we do, and I'm going to share one with you with our one of our practices. One of the facilities that we own is American Surgery Center, and they do have a webinar tonight for weight loss, and I'm going to just share that screen with you tonight. I see Dr. Singh, who's going to be doing the weight loss webinar. Now, this is through American Surgery Center. American Surgery Center and Christiana Institute of Advanced Surgery, we call them CRIAS. They have the bariatric program partnership, where we are able to get our patients in the program and make sure that they go through their clearances for the surgery. And these webinars do help for the one-to-one interaction with the surgeon. They're free, and then you would always follow up with the providers later on. But tonight we have Dr. Singh. Now, Dr. Erkan does the Facebook Live with these events with Facebook. Actually, the idea came from for me to actually start doing the Facebook Live. Idea came from the weight loss side of it, because I see the benefit and I see the direct reach to the patients. So Dr. Erkan did one this week, and this was his last one. But he does this every Tuesday, so this would be a good way to keep up with the weight loss updates, and also interact and ask questions. Now, I am going to have a couple of my other providers who are going to join me once we kind of master what we are doing. So then we are not wasting our time. We are also, we are not wasting their time and your time, honestly. So that we are, I don't see my American flag, then I get, it's my obsession, sorry. So the way that I'm going to do, we'll have our social worker who's going to join me later on, not today, but we'll actually schedule those. Some of our dietitians will be with me, and some of our providers will be with me. So our goal is to kind of have a platform to just have a free discussion. There may be, some of you may like this and some of you may hate it. If you hate it, you can always turn it off so you don't have to watch it. So that's easy, right? But if you are interested in, and if you would like to know more about what you are doing, what we are doing, then you can actually come and watch us for 20 to 30 minutes every week. That's what we are planning to do. Now, I don't know if we have any questions posted or anything. Tanner, is it from your side? Now, we are going to make this video available offline, and I know that we are getting a lot of questions later on. If we can have some, if we can help you with some of your questions, and knowing that you know that we are available here, I'm hoping that we can kind of make certain things a little bit easier for our patients and for the public. Now, one last thing that I would like to say is that last night we did our session 82. What that means is 82 different sessions with our providers. So to keep everyone together, making sure that our providers are up to date with the most recent updates, and then they are able to actually see what's happening from the COVID side of the business. And now, what you need to remember, the reason I brought this up is this is from United Medical Clinic. You are, from the patient point, we are enabling telemedicine at a great extent. In fact, we probably are the pioneer of telemedicine in Delaware, so we have made this available to all of our providers. We empower them with the technology and we support them, so that's why I'm actually sharing this. So not only with your primary care physician, but with your specialists, the best right now is for people to avoid in-person visits as much as possible. Now, I say the same thing in the same presentation. I say there are certain hospitalizations that should be happening, shouldn't be delayed hospital admissions. So while we are saying that, we want to make sure that we also understand that if it's avoidable, then we can do everything through telemedicine. Right now, I'm in my office, and Tanner has his mask on. He's on the other side of the table. All of our employees here, they have the social distancing rules in place. We get our temperatures taken every morning, and it's recorded. We still have all of our meetings through webinars and web meetings, so we still don't do any in-person meetings. So this is kind of our contribution from our side, and I believe everyone should be able to follow the similar rules. This is just for our own good, and I do believe that we are going to get out of this, and then we'll be stronger than ever after we deal with this, and I do believe that we are going to come out of this stronger. Well, I do thank everyone to be part of the presentation. Either watch it live or if you are going to watch it later on. So I'll just thank you in advance. And please let us know if we can do this in any different way, any better. We are open for criticism. And you have a nice week and nice weekend. We'll see you next week. Thank you. Bye-bye.